Randy was sick around the world, sick by T.R. Reid. Yes, and Purple, you had a question a while ago. Yes, ma'am.
I have two. One, I think now is a clarification question about single payer. I'm gathering will wipe out all the existing insurance companies so they don't exist anymore. That's an awful lot of jobs lost. Is that not correct? Because I know Medicare is administered by a number of health insurance companies.
There are 2 million health insurance workers in the United States. There's a provision in H.R. 676 for $20 billion to retrain those people who want to be retrained to do something else. And really, you know, I think it's a relatively small price to pay for everybody to have coverage in this country. And incidentally, those same health insurance workers are going to be very valuable to a single payer system by, you know, working the claims and so on and so forth. It's just helping to administer a single payer system. We're going to need those folks. And the other thing is that the insurance companies can still make profits on their other insurances, but they cannot make a profit on health care, sickness, or health care that is covered by the single payer system, the basics. They can insure the frills, they can insure the cosmetic surgery, they can insure the private hospital rooms, blah, 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 that people might want to buy. But this is not going to be the end of the private insurance industry.
There's a provision in H.R. 676 for every displaced insurance worker to get their salary for 2 years up to $100,000 a year as their unemployment benefit for being a displaced insurance worker. I guess that leaves out the CEOs. I guess they won't have a salary over $100,000. Too bad.
Well, I'll take a couple more and then we'll move on. Yes, ma'am.
I realize that due to poor decisions made in matters of habits and lifestyles, which according to the movie we saw a little bit ago, holds a 40% determinant on that pie chart, many people are in serious need of help for their dis-eases and discomforts. And it makes no sense to keep on throwing good money after bad by handing out prescription drugs, many of which cause worse side effects than the problems they're supposedly treating. People won't smart enough to realize why they're sick. So what provisions will your proposed plan have to make us all accountable for our own good health in the way of education on better lifestyles, which will prevent many illnesses to begin with?
Good question.
Well, I'm a pediatrician, and if this system is funded well, pediatricians will be allowed to take care of children and give their parents advice about exercise, diet, nutrition, and provide them with the kind of advice they need to help them get educated, dealing with their learning problems, and all the things that affect children's development. That's the best way to make people healthy, is to make their children healthy. As far as punishing people for bad decisions that they make, that's a tough one, because where do you stop? And, you know, if you punish somebody who smoked cigarettes 20 years ago and then quit, they get cancer at a fairly high rate too. The problem is, who do you punish? Who is this person who oversees, who decides who made stupid decisions? And that's why I'd say be really careful about that. But again, the best way for me, the reason I went into the field that I did, because if you want to make people healthy, make children healthy, both their physical and their mental health. And the system would allow that.
Ms. Kate.
We made a decision a long time ago as a country that we were going to go, if somebody's house was burning down, we weren't going to say, well, did they have too many newspapers stacked up, or did they not store their paint correctly, or were they smoking in bed? We go put out the fire, right? And secondly, I think we should put out the fires with healthcare too. And secondly, I'm a primary care doc. I see everything. And I don't see people want to be unhealthy. I see people who want to lose weight. People want to stop smoking. People want to quit things. I had a gentleman come in who'd been using he told me he'd been using them for 17 years and he wanted my help to quit. I had a panic attack because I thought, I don't know anything about meth. This was about 7 years ago. I know a lot more now. But I was able to help him by listening to him. He's been clean for about 4 years now. So people want to have better health, and what they need is access and our support, and we will have a healthier country. I have enormous faith in people's ability to change.
And the reality is we're going to take care of them when they get sick anyway. So these people that are abusing themselves, and it's real, but we're going to take care of them anyway. So if there's anything we can do to help them, it's a good investment in our money. It's the fiscally smart thing to do.
Great. One more question. I'm choosing a lot of women. Gentleman in the orange shirt.
I paid quite a bit of attention, actually took notes on President Obama's speech, and it seemed like at the end the next day I summed it all up, and it seems like what he's proposing, and I don't know about HR 3200, but is a system similar to Massachusetts plan where you're mandated to buy health insurance, and where if there is a public option, then it's being paid for by the rest of us. For people that can't get into it, there was no saying that there were going to be caps on how much you had to pay or were allowed to pay or anything like that. Massachusetts is $400 billion in debt in 4 years because of that system, and this is exactly what I cut out of the president's speech. I mean, I love the man. He's tall and good-looking, charismatic, and I'm just so glad he's not George Bush. But this kid,
We thought we elected Obama, but all we got was a skinny Mitt Romney.
Yeah, you're absolutely right, sir. The Massachusetts plan is a complete flop, and everybody needs to know that. So when you hear the Massachusetts plan touted, don't believe it, folks.
Let's move on to the Madison thing, shall we, Todd? So this is kind of where we feel like what we're doing up here is a campaign, but we'll never get single payer with a campaign. We will get single payer when it becomes a movement, and that depends on all of you. So we're only practicing a couple of things, like I said earlier. One, it's really important that we practice getting up in front of our community members and speaking our minds. So we want to encourage you to come up to the microphone. You have 60 seconds and 60 seconds only to tell us why you're mad as hell. A couple things. Would love if you feel comfortable starting your statement with "I'm mad as hell because." And also know that if you do come up to the microphone, you might show up on the internet. And then you're kind of tacitly agreeing to let us use it. So that is your choice. The other thing that's really important is whether you agree or disagree, let's let people have their 60 seconds. It's also an exercise in listening.